On today's The Doctor is in flu season. Even though we are barely getting into fall, it's probably time to start thinking about it. The peak period is usually January and February, but cases can start popping up as early as this month. Dr. Scott Ackerman is one of the First Coast's leading doctors. He is joining us today with what you need to know to keep yourself healthy now and all winter long. No one likes getting the flu,
No,
Dr. Ackerman.
no.
It's just not enjoyable. So we talked about when is flu season. It technically, as you said, I just read the full is January to February, but I mean, it is starting now for some people.
Well, so you're right. In January and February, we see the largest outbreak of the flu.
Okay.
But the flu season actually begins in November, and it goes from November through early February. And it's important to be vaccinated for the flu before the flu season starts, because once it's out there and around, you can pick up
More
the flu.
prevalence, sure.
Right. So it also takes about 2 weeks for the vaccine to become effective. It takes time for the body to build up its immunity. So I encourage people to go out now and get their flu shot and get the flu vaccine. And you get your flu shots at the grocery store, at pharmacies, from your primary care physician, from your specialist physician sometimes, even in the workplace. A lot of companies are offering it. We're offering it in our office for our staff, I think next week or week after next.
Yeah, and so who do you recommend gets the flu vaccine? Everybody?
So we used to just recommend those high-risk people, but really now, because the flu shot is so well tolerated and there's very little side effects from it, and the prevalence of flu can be so much and the complications of it can be bad, we recommend the flu shot now for everybody. Anyone older than 6 months. Below 6 months, there's problems with the immune system that hasn't built up yet, but anyone older than 6 months, I recommend they get the flu vaccine. Especially those people who are at risk for complications, excessive complications, if God forbid they were to get the flu.
Sure.
So young children should be sure to get the flu shot. Those who are elderly, especially living in nursing homes where there's a lot of contact with other people, they should get the flu shot. Those people, pregnant women, people with chronic heart conditions or chronic lung disease such as emphysema or asthma, if they get the flu, that can be very detrimental. And anybody that has a compromised immune system, such as patients that are maybe HIV or patients with diabetes, they should also get the flu shot.
I just want to ask you, because it said pregnant women could get the flu shot. I was just one clarification, because I know some women who are pregnant are a little concerned about getting the flu shot because they don't want to have the ramifications on the fetus,
Right.
if there are any.
So pregnant women should get the flu shot, because if they get the flu, that's a lot worse on the fetus.
Okay.
If they're sick and they lose weight and
Okay.
they have all sorts of they're laid up in bed with the flu while they're pregnant, that's not so good for the fetus either.
Got it.
The flu shot activates the woman's immune system and helps prevent her from getting the flu.
Okay.
So it's perfectly safe for pregnant women. We don't want we'll get to a little bit about the different types of flu vaccines, but the ones with live virus, we generally recommend that pregnant women don't get those.
Yeah, and also side effects. And another thing that I've heard people say, if I get the flu shot, then that will give me a greater chance of getting the flu. Some people think if you get the shot, you're putting the virus essentially in your body, therefore it gives me a higher percentage that I'm going to get it.
Right. Well, that's a fallacy.
Okay.
So the flu shot won't give you the flu. The flu shot is made from a dead virus. So we have the vaccine goes 2 ways. We can either give it a mist, that's a new thing now, or do the mist, or we do the shot. So the shot is a inactivated virus. It's a fully killed virus.
Okay.
The mist, which is a nasal spray, you saw it in the video a second ago that was behind us, that mist has some weakened live virus. But neither one can give you the flu, but either one you can have some side effects from as the body's immune system is gearing up and is being activated. There's some side effects associated with that. So those side effects, as the body's immune system is getting geared up, include things like headache or low-grade fever or just a little bit feeling of malaise. And usually that lasts for a day or two. But the shot will also give you some soreness at the injection site. And the mist in the nose gives you a little bit of runny nose. It can give you a headache, that sort of thing.
Is there one that you recommend more than the other, or this just depends?
I like the shot. It's easier. Just go in and get the shot.
Yeah, you were going to say that we were going to do the shot here today with me, but
I threatened you.
You did. I'm such a wimp when it comes to needles. If you end up getting the flu, and man, nothing is worse sometimes than feeling like when you have the bad case of the flu and you're achy and fever and sick and coughing and can't sleep. And what do you recommend if someone does get the flu? Obviously, some people try to come to work, but you should stay home. I mean, first and foremost.
Absolutely. Well, first of all, remember that if you get the flu shot, it doesn't mean you're immune from the flu. The flu shot is for the most active, the most prevalent viruses that are out there, but there are some viruses that the flu shot doesn't protect against, so you can still get the flu, but your chances are much, much less.
Okay.
So just because you can still get the flu, that's no reason not to get the flu shot. You should still get the flu shot. But if you were to get the flu, the best thing to do is to protect others from yourself. So stay away from other people. Stay home. You don't want to spread the germs. You don't want your friends and family to get the flu. And you should stay quarantined or away from other people for at least 24 hours after the fever breaks. You're contagious, believe it or not, from for a day before symptoms begin until about 7 days after the onset of symptoms. So kind of keep that in mind. And also, if you were to get the flu, there are some medications that we have now, some antiviral medications that are available by prescription to help, not to cure the flu. You can't really cure these viruses. They have to run its own course, but it can help reduce the duration and reduce the intensity of the symptoms of the flu. So see your doctor for those.
All right, Dr. Ackerman, as always, take some popcorn on your way out, will you?
Oh, I will. It looks really good.
That's some good stuff. All right, from the doctor, thanks so much for being here again and for keeping us healthy, of course, as we enter into flu season. If you'd like more information on anything that we talked about here today or questions regarding this topic or, hey, any other questions that you might have, you can contact Dr. Ackerman on his Facebook page by going to facebook.com/First Coast Oncology.